Some treatments for diverticulitis. Have you ever heard of these treatments for diverticulitis? You should constantly take care of your body. After all, it's necessary to keep adding more and more healthy habits into your lifestyle that allow you to have a good quality of life and to help you avoid setbacks. When it comes to health, you shouldn't hesitate, and you should pay attention to the details. Therefore, you should communicate with your doctor about any situation that you're worried about. One of the conditions that you shouldn't overlook is diverticulitis. Its origin, the large intestine, can go from a minor issue to a lethal magnitude. Because of this, it's recommended that you do everything in your power to follow the dietary habits that prevent the development of this disease. Treatments for diverticulitis. A very important point is your diet. It's essential to follow a diet that's rich in fiber to the T. In fact, to prevent the illness and to avoid worse problems, it's recommended that you eat fruits, vegetables and grains. We suggest increasing your fiber consumption gradually so that your body can adapt to the change. That way, you can avoid the possibility of suffering from any abdominal pain. This is if the illness has not reached a very serious level. Among the foods that tend to be helpful when dealing with this difficult situation are cabbage and broccoli. Potatoes, wheat bread and apples are also great options. Recommended recipe. An easy recipe to make is one with lentils and mushrooms. To make this dish, the following ingredients are necessary. Ingredients: 1 1/2 cup of lentils, 350 grams. 2 cups, 450 grams, of mushrooms. 1 head of garlic. 4 tablespoons of olive oil, 60 grams. 1 teaspoon of flour, 3 grams. 1 large onion. Preparation: cook the lentils and then put them in a skillet with the oil and mushrooms, already chopped, and the onion. Mix and add the garlic. If the issues continue or get worse, you should not continue eating these foods. A couple of days later, the discomfort should decrease considerably. From there, you should start a diet. Another habit that you should adapt for the well-being of the affected area is drinking water constantly. Pay attention to medications. On occasion, you might also be told to take a fiber supplement. By choosing this alternative as a solution, it's normal for the doctor to ask the patient to take it 3 times a day, since the doses of this supplement provide your body with up to 10 grams. With the help of your doctor. If the situation gets worse, there are also other methods to treat this illness. For example, bleeding is one of the ways that this illness can manifest. Although on occasion this can stop without the need for any treatment, you should still go to your doctor in case the bleeding occurs from the rectum. In these situations, the specialist will try to locate the place where the bleeding originated through a colonoscopy or computerized tomography. If it doesn't stop, the last option is an abdominal intervention, known as a colon resection. Its purpose is to eliminate the most affected part and then tie up what is left. Among other issues that come with diverticulitis, and that also require rapid intervention, is peritonitis. This requires surgery as soon as possible. If not treated fast enough, it can be deadly. If the patient suffers a perforation in the affected area, it also has to be operated on. Abscesses are also protagonists. With little impact and danger, the specialist has to work to drain it if the prescribed medications have not taken care of it. People who have suffered from this disease have seen how the intestines are obstructed on occasion. Only if the blockage is total do you have to have the operation. Just a partial obstruction doesn't necessarily mean you need to go to the operating room.